Why Alexa's bedside manner is best for healthcare. Using this new feature which Amazon labeled as a skill, a company named Livongo will allow diabetes patients, which is called members, to use the device to query their last blood sugar reading, blood sugar measurement trends, and receive insights and health nudges that are personalized to them, along with messaging and exercise logging. And Maven Clinic, which is not actually a physical place, offers online medical guidance and personal advice focusing on women's health needs. He believes technology will help patients receive help during medical crises, citing the benefits of home monitoring and the ability of doctors' visits to be conducted by video conference. But when I returned from Brainstorm Health, I was confronted by an alternative reality of virtual medicine, a medical bill for a telehealth visit that resulted from one of my kids calling a long-time doctor's office. It was for a 5-minute phone call answering a question about a possible infection. Virtual communications have streamlined life and transformed many of our relationships for the better. There is little need anymore to sit across the desk from a tax accountant or travel agent or to stand in a queue for a bank teller. And there is certainly room for disruptive digital innovation in our confusing and overpriced healthcare system. But it remains an open question whether virtual medicine will prove a valuable, convenient adjunct to healthcare. Or, instead, will it be a way for the U.S. profit-driven healthcare system to make big bucks by outsourcing core duties while providing a tailored version of actual medical treatment? After all, my doctors have long answered my questions and dispensed phone and email advice for free, as part of our doctor-patient relationship, so it didn't have a tool branding moniker like telehealth. And my obstetrician's office offered great support and advice through 2 difficult pregnancies. Maybe they should have been paid for that valuable service. But for a phone call, which works out to over $0.000 per hour. Not even a corporate lawyer built that. Watch, but I'm not sure that's medicine. And, if virtual medicine is pursued in the name of business efficiency or just profit, it has enormous potential to make healthcare worse. My doctor's nurse is far better equipped to answer a question about my ongoing health problem than someone at a call center reading from a script. And, however thorough a virtual visit may be, it forfeits some of the diagnostic information that comes when you see and touch the patient. Oh, the prescribing is at work. It makes sense. A doctor can use a stethoscope to listen to lungs or wiggle an otoscope into a kid's ear by video. Similarly, a virtual physical therapist can feel the knots in muscles or notice a fleeting wince on a patient's face via cameras. More important, perhaps, virtual medicine means losing the support that has long been a crucial part of the profession. There are programs to provide iPads to people in home hospice for resources about grief and chatbots that purport to treat depression. Maybe people at such challenging moments need and deserve human contact. It would allow such digital monitoring tools to qualify for reimbursement, if they are clinically endorsed. But, ultimately, will the well-being of patients or investors decide which tools are clinically endorsed? So far, with its new so-called skill, Alexa will be able to perform a half-dozen health-related services. In addition to diabetes coaching, it can find the earliest urgent care appointment in a given area and check the status of a prescription drug delivery. But it will not provide many things patients desperately want, which technology should be able to readily deliver, such as a reliable price estimate for an upcoming surgery, the infection rate at the local hospital, the location of the cheapest cholesterol test nearby. And if we're trying to bring healthcare into the tech-enabled 21st century, how about starting with low-hanging fruit? Does any other sector still use paper bills and faxes? Thank you for watching. Please subscribe.